Hi. Well, thank you for having me. I just want to get kind of a feel for how much you guys already know about health coaching. How many of you, by a raise of hands, are familiar with health coaching? Okay, so I have a few of you out there. You've heard it. Can't hear yet? Better? Better? Okay. Health coaching is a bit of a buzzword right now, so I hope to demystify that for you today and how we use health coaching at our center and at Vanderbilt in general. So, I'll just go there. So we know that chronic diseases like, thank you, heart disease, stroke, cancer, and diabetes are really among the most prevalent and costly diseases that we're dealing with today. In Tennessee, heart disease is the #1 killer at 27%, cancer 23%, stroke is responsible for 6%, and diabetes, 12% of the adults in Tennessee have diabetes. When we look at part of what's driving these disease processes, we're looking at pretty much 5 behavioral factors that have been shown across the board to mitigate costs and increase our wellness. Sufficient activity and sufficient exercise and physical activity. I am sad to say that Tennessee ranks #1 in levels of physical inactivity. Yes, maybe not right here in Nashville, but we're up there. 48.2% of adults are physically inactive. A healthy diet. Only 26.2% of adults in Tennessee meet the recommended value, eat the recommended servings of fruits a day, and that's 2. That's not very many. But I know I struggle sometimes. Only 33% consume the recommended amount of vegetables, and that's 3 servings per day. We also, part of the disease processes that we were just talking about, part of the drivers are toxic substance exposure, and we're talking about things like smoking, drinking, pollution there. In Tennessee, 25% of adults smoke, and a pretty staggering number, 21% of high school students actually smoke. Yes, yes. And then as far as heavy drinking goes, 3.4% of adults are qualified as heavy drinkers. As far as binge drinking, 8.6% in Tennessee. And that number's below the national average, so we're doing well here. That's an area that we're shining. This is good. Stress management, we're ranked 14th highest stress rate in America. These statistics are a little bit staggering, aren't they? I was a little dismayed when I was gathering all the data for this talk.
What's that based on? Because we didn't challenge that.
This is based on I have the report here. It was a 2012 survey report done by the state, and they're calling the data for all of that. It's we can go through that. I can look and email you. I can try and look and see exactly. Are you talking specifically to stress in general? Typically, they're doing certain stress measures. Sorry, what is that? Okay, I apologize. Typically, there are certain stress measures that are used. We use something called the short form at our clinic, but there are different measures that are used. But I can see if you're interested after what measure they were using specifically for that. And then early detection and intervention. This is our ability to catch cancers before they progress. And, 20% of women 40 years and older have not had their mammogram in the last 2 years. And 44% of those 50 years and older have not had a colonoscopy. So these are just some of our statistics. The main headings, again, sufficient exercise and physical activity. You want me to read all the statistics below that? Okay, healthy diet, reducing toxic substance exposure, smoking, alcohol, pollution, stress management, and early detection and intervention.
Will you be putting these online?
Do we have availability to do that?
Yes.
I'd be happy to do that for you.
Put your PowerPoint online for the later.
Great. Okay, great. So right now there is a gap. When we're looking at these healthy behaviors, the people that are typically charged with managing these are primary care providers. They are the ones that are managing how you're doing in regard to taking your medication for these disease processes, and they're typically the ones that are charged with encouraging people to adopt these healthy behaviors like screening, not smoking, not drinking not excessively drinking, exercising, those types of things. But we're seeing that that's not happening in primary care visits on average. And when we're looking at the reasons behind that, research is pointing to a few different things. The first is the lack of time. The average primary care visit is 15 minutes long and covers 6 topics. So that gives your provider 2.5 minutes to really address these topics in depth, right? So that's not typically happening. Another aspect is that clinicians do not feel like they are adequately trained to counsel about behavioral issues. That's not a big focus in nurse practitioner school, physician's assistant training, or medical school. It's exciting. We have been asked to come and teach first-year medical students how to do certain health coaching skills so that there is an improved communication with patients. So that is exciting. Things are changing. But currently, this is what providers are reporting. And a statistic around that is that 50% of patients leave not knowing or understanding what a provider has said to them. That's a big number. So there's a gap right now. And finally, information alone is not enough. When I went through training, I was taught that if we just educate people of why they need to exercise, why they need to eat well, just give the facts and people are going to be motivated, right? Something's missing there. And that was part of really what got me into health coaching. I was working in a homeless population and educating, and I wasn't seeing changes, and I was really frustrated. And I now am taking ownership that I was part of the problem. I wasn't using communication techniques that were going to foster motivation in my patients. I really did think that education alone was enough. So, let me talk to you a little bit about what does make behavior change successful. There are 6 facets, as you can see up here. The first is that the patient or the person needs to understand why they need to change, and that is where education comes in, right? If someone doesn't know that eating fruits and vegetables will prevent some of these chronic diseases later on, that can be helpful in giving the why behind the change. But then the person needs to want to change. And we can't make people want to change. We can use techniques to help them start to see how this may increase their quality of life, but we can't just give them the pass to want to change. Their values need to be reinforced by change. And what I mean by this is if a provider tells you that, say you work 70, 80-hour weeks, and a provider tells you that you need to start exercising an hour a day, but the only time that you have with your family is in the evening, in that one little chunk of time, you're probably not going to exercise, right? So when we're looking at change, we need to make sure that these values are being reinforced by the change that we're looking at. We need to have a plan. So how do we get from not exercising at all to exercising 5 times a week, 30 minutes a day, and 2 strength training days in there, right? Support and resources. We need to know how we're going to do it. If we're trying to quit, we may need a patch. We need certain resources that are going to help support some of those behavioral changes. And finally, it's important to address resistance at the onset and also work with fostering motivation. Those are 2 of the keys when we're talking about working with behavior change. So who is going to do this in our healthcare system? And that's where I present the missing professional, which is a health coach. This is a credentialed member of the healthcare industry who combines their medical expertise with coaching to address behavior change management over time. One of one of the doctors at UC San Francisco. His name is Thomas Bodenheimer, and he is one of the foremost researchers in health coaching and has really brought health coaching into primary care and into medicine in general. He started this about, I think his first study was 6 years ago. He defines health coaching as helping patients gain knowledge, skills, tools, and confidence to become active participants in their care so that they can reach their self-identified health goals. And this is our health coaching approach at Vanderbilt. Just to give you a little idea of how we focus with a patient on health coaching and on behavior change. We start, if you come to see a health coach at Vanderbilt, there's going to be a starting with the relationship. That's the key to anything. We look at psychotherapy outcomes, and the one key predictor of how a patient does is whether or not there's a positive relationship between the provider and the patient. So that we spend a lot of time focusing on trust, collaboration. In health coaching, we talk about coming alongside the patient. As a health coach, even if I am a nurse practitioner, I do have expertise, but I'm not going to tell a patient what to do or try to convince them that my way is the right way. I'm going to come alongside them and talk to them about what it is that they want to do. And that brings us to our next thing. It's the patient's agenda. You know, your providers will recommend things that you need to do, absolutely, and some of these things do mean life or death. But how we start getting people into making changes in their life is by focusing first where they want to go. What is the one easy access point with people? And we really focus on that. We focus on engagement, and what I mean by engagement is getting the person involved, getting them involved in their care, rather than seeing the doctor as the person, fix me. They come in and they have questions. They're ready to be engaged. They have the skills and the tools necessary to engage in their health and their health care and their prevention in a different way than before. We focus a lot on values and strengths. I know that the patient is the expert on their health and well-being. I may have some ideas up here, but they have a lot of strengths that they're bringing to the table. And we really cull for strengths in health coaching, because in behavior change, when you've tried, how many of you have ever tried to change anything? Let's start there. Right? How easy is it? It's not. So we need to figure out what your strengths are ahead of time so that when we hit those bumps, we know how to access that and we know how to get you back on the horse. We also need to focus on values, and I've already talked about why values are important in making behavior change. Action and accountability, the constant doing, the constant working towards something. It's not just about thinking about something, it's about doing. It's about making small steps along the way. And then a focus on small successes that build. And what we're referring to here is the fact, if you look at something like smoking, the average person, it's 8 to 11 attempts before they truly are able to quit smoking. That's a lot of defeat. So when I have people that come to me that have yo-yo dieted their whole life or tried to quit smoking 11 times, there's not a lot of confidence when they're about to go back on this next endeavor. And so while we do set those really big goals of, yes, we're going to lose 20 pounds or we're going to quit smoking, along the way, we're doing small successes along the way to help build confidence over time that they are able to do this, they are able to make these changes. So at Vanderbilt, our health coaching process is, we start with an introductory health coaching session. In that, it's a 60-minute session. We develop the relationship. We do a focus on vision and values. We look through all of the behavioral arenas in your life, and I'll show you that wheel of health later. And we see, where are you now and where do you want to go in this respect. We then create a personalized health plan for you, and we map out the next, typically these relationships are about 3 to 6 months long, and then we map out how that works. And then our follow-up sessions are 30 minutes in length. We talk about how have you done with your goals that you've set, what successes have you had, what obstacles have you hit, what learning did you have about it. Really, behavior change is a detective process, It takes time, it's hard, and a lot of the coaching is around that. And then there's also quite a bit of education. If people need the education, it's there. And then again, we do next steps. So professional health coaches, there is no national standard. Let me start by saying that. This is a new field. And so what that means is if you want to work with a health coach, it's good to know how they've been trained. On average, most have been trained in either 3-month trainings up to 2-year trainings. Right now, there are about 7 that are nationally recognized schools that most of the major academic medical centers have trained their health coaches through these different schools. There is a certification process, so the person has to sit for an exam, has to demonstrate that they know how to actually do it, and then they're free to go on and act as a behavioral change agent. At Vanderbilt, we have 21 certified health coaches, meaning that they've gone through the 3-month program, one of the 3-month programs. There are 7 certified professional health coaches. They've gone through a year-long extensive training and exam process, and then there are 5 chronic pain health coaches who have been trained specifically through a chronic pain health coaching program. So where is health coaching being offered right now? You will see it in a retail setting. We typically call that wellness coaching because it's typically not for people with significant disease processes. When we're talking more along the lines of health coaching, while we do get some people that don't have any disease processes, most do have diabetes, obesity, hypertension, some kind of conditions going on. And we see health coaches nowadays in medical clinics, in primary care offices, medical homes. Integrative centers are a key place for it. Most of the integrative centers across the country do have a health coach. Hospitals, for people that are inpatient, there are often something called transition coaches now that are working with people as they transition from hospitals to home to make sure that medications are being taken as recommended and there are no symptoms that qualify for readmission. And then insurance companies. I don't know about you, but I've had quite a few calls from my insurance company. Their health coaches are calling people now and wanting to start relationships. And I would say that across the board, you're not going to find a cohesive definition of what these people are doing health coaching wise. And that's really where the research is coming in right now and trying to define specifically what makes a health coach. When you're looking at the disease management programs and insurance companies, a lot of it is education, specifically education focused, with not a lot of work on motivation or tying it to values or assisting people in actually implementing it into their lives. So, evidence there are many theories right now that are underpinning health coaching. We call health coaching a meta theory. We focus a lot in the healthcare setting on motivational interviewing, on positive psychology, on the trans-theoretical model. All of these help to let us know the types of behavioral change counseling techniques we're going to use with a specific person. And there is a growing evidence base for health coaching. When I first started health coaching, we didn't even have 50 articles yet. In 2010 to 2012, there are now over 150, which is exciting. There's a national consortium for health and wellness coaches. Many of the top academic centers across the country have come together to create national standards around health coaching and to support research to make sure that soon, when you go to a health coach, it's going to be completely, more standardized. It will be like going to a psychologist, for instance. And what are the outcomes that we're seeing in most of these trials? There are typically 4 that come up again and again, and that's improved quality of life, sustained and increased engagement in health-promoting behaviors, things like eating well, exercising, healthcare cost reduction. This is what the hospitals and the insurance companies like. And then improved biometrics, so that's weight loss, lowered A1Cs, lower lipid levels. And these are just a few of the conditions that health coaching has been shown in the research to improve. It has been shown to improve conditions as diverse as depression and cardiovascular disease and diabetes. So it's not just for the physical ailments, it can also be used for emotional health. And one trial that I did want to bring in today was one of the largest for health coaching. It was published in the New England Journal of Medicine in 2011. And 432 overweight, obese patients were randomized to either receive just self-directed education, remote health coaching support with self-directed education as well, with the web curriculum, self-monitoring, and then in-person support. So that would be in-person group coaching and one-on-one coaching. And this was over 2 years. Sorry, I thought I saw a hand. So typically what we see with weight loss is that weight loss is difficult to sustain over time. And so that's why this was a 2-year program and intervention. And these were the results. The control did lose weight, so they lost 0.8 kilograms. The remote group lost 4.6 kilograms, and the in-person lost 5.1 kilograms. So all of a sudden, the medical community took interest in health coaching. This was really, when this came about, all of a sudden we saw an uptick in health coaches at insurance companies. Really, we started to get hit pretty hard at Vanderbilt on, okay, what is this health coaching? People were excited about this because all of a sudden we had this randomized controlled trial that showed health coaching works. And for those of us in the health coaching field, what we were excited about was that remote was almost as good as in person, which means that telephonic is an okay way of providing health coaching. And as the person being coached, that's nice. It's nice to not have to get out of your pajamas to talk to someone, right? To have to come in and see someone. So I'm just going to go over kind of a case study of a typical patient. We'll call this one Miss Smith. Obviously, all important identifiers have been removed here. But this was a woman that was diagnosed with obesity and insomnia when she first came through the Integrative Health Center. After having her integrative consult, she was prescribed sleep hygiene. So she was told all of the wonderful things that she could do to help her sleep at night. A healthy diet was discussed in detail specific to her. She was given a prescription for that. Exercise, all of her exercise regimens were discussed, and stress reduction. Specific breathing techniques were recommended, ways that she could go about doing this. She ended up with me for health coaching, and during our intake, what I realized was she works 60 hours per week, her husband travels all during the week, and she has 3 children. And what she said was, "I'm tired all the time." Yes, you are tired all the time. And this is what we do to people. This is what I do to people. Well, hopefully not anymore. As a provider, we give all this wonderful information and these wonderful prescriptions, but where is that going to fit? And that's really where health coaching comes in. So what we did together was we worked on, okay, she chose the areas of nutrition, of exercise, of social support, and of her mind-body connection, of really working with stress reduction. And we worked together over 6 months. And what we did was we figured ways that we could increase the meaning behind each of these things. Why is this personally relevant to her? What will this do for her? Right? Let's bring it out of the abstract of a thing to do and make it a thing I want to do. And then we worked on how do we put this into your life? What are the baby steps of getting these things in your life? So at the end of the 6 months, this is not her, but it could have been her. She was happier. She was eating balanced diet in moderate proportions. She said to me, "I no longer, when I see the donuts on the table at work, I no longer have to have 2. I can pick one up, take a bite, and put it down. I'm regulated around this." Because she was going for what was beneath. right? She was going for the thinking and the feeling behind her desire to do it rather than just going straight with that compulsion or that desire. She was exercising 4 times a week. She had figured out that no, she didn't have any room when she was at home to exercise, but she did have a 30-minute lunch break, and she worked anyway through that lunch break, but hey, she could take a lunch break and actually go out and walk. She was doing morning prayer, and she was spending 1 night a week with friends because it was important to balance that. That was a stress reliever for her. She was getting that social support she needed. So what came out of that? She lost 15 pounds. She was sleeping better. She no longer had insomnia. Her mind wasn't waking her up at 3 in the morning spinning. And she had a lot more energy. So that's just kind of one example of health coaching. So now it's your turn. I want to walk you through at least a couple of the exercises that we go through in health coaching if you're game and willing. And I'll start by just showing you the wheel of health that we use typically here. So when we're talking about health, we're not just talking about physical behaviors, we're talking about all of you. So we're looking at things like movement and exercise, nutrition, life, meaning, and purpose. And when we talk about that, we say it's the why for why you get out of bed in the morning. Medical and wellness care, that is your preventative exams, things like that. Stress management, social support, sleep and rest, and your environment. How much pollution do you have? How much noise pollution do you have? Those types of things. Those have all been shown in research to affect health. So, the vision. In a health coaching session, we start with visioning, and what this is we have someone picture what could be possible for them if that wheel of health was balanced. If they were doing the things that they wanted to be doing and knew that they could do, what is possible for them in a certain amount of time. And the reason that we do this is it provides the why behind the mundane activities that we're doing. It gives us something that we're moving towards. It helps to foster that motivation. It is typically grounded in our values. And one thing I do want to note, that this isn't something off in the distance that is just la-la land. This is grounded. If you have type 1 diabetes, in your visioning, we're not saying that you're not going to have type 1 diabetes, right? But maybe you're managing it in a way that's more effective for you, or helping your blood sugars stay more consistent. So, if you guys are willing to play along, I'd like to do a little visioning process with you. So if you can uncross your legs. Some of you have already had some mindfulness in here before. Okay, so close your eyes if you're comfortable. If you're not, you can just relax your gaze down below and take a deep breath. So I want you, at this point, to picture where will you be in 1 to 3 years' time if nothing at all changes in your health. If everything stays the same, you're eating the same, doing the same amount of exercise, drinking the same, where will you be in 1 to 3 years' time? And look at yourself. What are you wearing? What does your body look like or feel like? What's your emotional landscape like? Who's with you? And where are you? Okay, and take another deep breath and let that go. And now I want you to think about your ideal health. If everything on that wheel was balanced, and you were doing the health-promoting behaviors that you know you can do, if all of them were balanced, where would you be in 1 to 3 years' time now? So again, really look at yourself. What does your body look like? How do you feel? What does your emotional landscape look like? Who's with you? And where are you? Okay. You want to come back? Now, typically, I have people share. This is a pretty large group. If someone wants to share, that's fine. That'd be great. Anyone? Okay. Well, what usually happens, you may have the same vision, okay? If you are living your life in balance right now, you may have the same vision, and that's incredible, and that's wonderful. But for a lot of people, I would say the majority of the people I work with, there's a difference between that first vision and the next one. And the next one shows a way of living if you're a little more intentional with what you do on a daily basis and the behaviors that you engage in. And it's typically pretty motivating to people. I walked through this just yesterday with someone, and there was a big shift for them in seeing what could be possible for them just if they made a couple of little changes on a regular basis. Mm-hmm.
Could you say something that might be appropriate to people of my age who are retiring?
Mm-hmm.
They don't have the people they used to work with.
Mm-hmm.
So the social presence of people is not there anymore.
Mm-hmm.
And also they are don't have the work that they used to have to do.
Mm-hmm.
And they are perhaps don't have the energy they used to have. And so when they live 3 years from now,
Mm-hmm.
it's hard to look and see
Mm-hmm.
that's going to be better.
Mm-hmm. Mm-hmm. And that's a very real concern. And in that situation, what we're looking at primarily is health and just like you're saying, and the social support and all of that. And what we would do is probably look a little bit closer. So if we could make specific changes in regard to social support, whether that's, I've worked with a lot of people that are socially isolated, whether that's starting to do one group class, or those types of things that would get people into a more socially supportive environment. What could be possible in 6 months' time? And that is how we typically do that. It's a little bit more in depth. And I'm sorry, we get the visioning process. It's different for every person. And we can talk about this after. Yeah. That's okay. Yes?
The person that you're closest to is your personal care physician,
Mm-hmm.
Primary care physician.
Mm-hmm.
Do they know, and you confide in them,
Mm-hmm.
do they know to refer you to a health coach?
Some do, some don't. And your primary care physician may be your health coach, right? If you have a supportive relationship and they're working with you on actually implementing the behavior change into your life, then that's wonderful, and that's a boon, and that's really what a lot of primary care providers have been in the past for some people. But if not, if the provider is more rushed or they don't have the time to actually invest in that, some do and some don't. A lot of what's being done right now is education to providers and to clinicians. We do a lot of training to clinicians. Yes?
So how is this, does Medicare cover this? How do they respond?
Does Medicare cover this? No, not right now. And we're working towards it. We are working right now to figure out how non-billing providers can do this. And I have more. Are we ready for a little bit more, or is that okay? Okay. So, We then typically go into the current and desired states, and what I'm talking about here is we go through each of the wheels, the areas in the wheel of health, and we see where are you now, and where could you be if you made some changes to those areas? What's possible if you started to do some of the things that you know you should be doing, or that you have always wanted to do but you just haven't implemented in your life? And so I will walk you all through 2 of these, just to give you an idea, just to start thinking in this way of where are you now. And again, some of you may be perfect, and I applaud you. I am not perfect, so it's good for me to go through this on a regular basis too. So let's start with nutrition. The foods and the fluids, the waters and drinks that you put into your body on a daily basis. So on a scale of 0 to 10, if you were to rate yourself right now, and just to give you a framework, if 0 was you're not eating anything but Cheetos and coffee all day long, okay? And 10 being you are living and eating that perfect diet that did all of you see Abby, who talked about whole foods, and right, your diet is completely whole foods based and natural, and it's wonderful. You're getting just the right amount of proteins and fats and carbohydrates, right? So where would you rate yourself? And just sink into that a little bit. And then if we're going to go a step below that, if we're going to unpack that number, what does that really look like? So kind of scan through your day if you can. What are you eating? What are you drinking? Are you getting breakfast? Are you getting lunch and dinner, snacks? What does that look like? And I hope that all of you are at a 10, but if you're not, what does a 10 look like to you? What's a realistic 10 to you? Is it adding in 2 servings of vegetables and then you'd be at a 10? What are those things that would make you a 10? And then we always ask for our patients, what questions do you have about nutrition, right? We want to make sure, we can't vision what a 10 is if we don't know what a good diet means. Because good diets mean different things to different people, and even different authorities. So, and then how ready am I to work on this? And we always ask this question because we want to go where the person is ready to work. We want to go where there's the most motivation first, because what happens is, and this is something that I see across the board, is that when people start making changes, typically in one area of their life, it trickles into all the areas. The person starts eating well. Wow, all of a sudden they have more energy and they can go out and walk because they're not so fatigued. And then they're walking more. Oh, they're reaching out more to different people because they're not as depressed. So there's often a trickle effect that we see with people. And then if we were to look at movement and exercise, your current movement, and I know you did some movement with Dr. Birdie, some of you did. Where would you rate yourself now on a scale of 0 to 10? 0 meaning you're just sitting in front of the television all day long. And 10 meaning that for you and where you are in your life, you're getting a reasonable, an ideal amount of physical activity that you and your healthcare provider have talked about. So again, rate yourself. And what does that really look like? And a lot of times with this one, I'm just going to say, people will say I'm at a 0, but they're actually walking their dog around the block twice. Okay? So don't underestimate yourself. People underestimate themselves a lot. So what do I want my movement and exercise to look like? So what could you add in that would make you feel better? Add a 10. And then again, we ask what questions do you have and how ready are you to work on this? So just a note, obviously this is just a demonstration of what we do in a health coaching thing, but if this inspires any of you to make changes to your diet or exercise, please do talk about this with your primary care provider. And then we go into setting goals. So at this point, we've seen where people want to go, they've seen where their life is now, and then they typically choose an area. So choose an area on the wheel of health that they want to set goals around. And we start by setting 3 to 6 month goals. The reason we set 3 to 6 month goals is based on goal setting theory, which is that it's a short enough period of time that people feel motivated to keep working towards it, but a long enough period of time that you're going to see substantial change. And then we set weekly goals, which are really the stepping stones to those 3 to 6 month goals. And just a few ingredients for successful goal setting. We want our goals to be challenging. We want to be reaching towards them, yet realistic. So it wouldn't be realistic to set a goal of losing 70 pounds in 3 months. That would be an unsafe goal. But we want it still to be challenging. You're working towards it. It's not something you can do in your sleep. Again, value-based. We want you to be committed to the goal, that it's going to be bringing you closer to your values. And then regular feedback. So having some kind of a feedback cycle, whether it's just saying to your partner, yes, I completed that, or checking in with a coach or your healthcare provider. But that typically makes goal setting more successful for people. We set our goals. How many of you are familiar with SMART format? Okay. The way that we format our goals, so when we set our goals, we make them specific, measurable, action-oriented, realistic, and time-based. And the reasoning behind that is because that lets us know whether or not we've met the goal. So if we just say, I'm going to exercise more, how do we know whether or not we've met that goal? So if we say instead something like, I will walk 25 minutes 3 times this week, we can be very specific on whether or not we've met that goal and where we are in regards to getting towards that goal. So we walk people through 3-month goals, and we start this by just asking them to choose an area and see what do you consistently want to be doing 3 months from now. How does this bring you closer to your wellness vision? So again, the why behind setting the goals. And an example might be, I'll practice deep breathing for 10 minutes, 5 evenings before going to bed to increase peace of mind so that I'll feel more relaxed in my personal and professional life. And we also focus a lot on importance and confidence. We ask them to rate it on a scale of 0 to 10. The reason behind this is because if it's not important or the person is not confident that they can do this, then it's probably not going to happen. And we want people to have the greatest success that they can. If the numbers aren't at a 7, this is a really good opportunity for some intensive behavioral counseling around motivation, around values, around possibly even resetting goals if they're not meeting these criteria. And then we choose small goals that are going to get us to these larger goals, and these are the ongoing processes that help people maintain engagement in their health process. Okay. And then finally, the goals are up here, and then we need to put the scaffolding under them. So how do we help our patients, or how do we help people become successful with meeting their goals? We start by creating a plan. We list the steps that are necessary for meeting the goal. So if I decided that I was going to have a healthy smoothie 3 times a week, my coach would walk through with me, okay, what needs to happen before you do that? Oh, I might need a blender. That would be helpful. I might need to go to the grocery store. Just a few of those types of basic things. But it's just amazing how often I do this all the time, I set goals and I don't have anything in place to implement them. So I know better. And then when will the steps take place, where and how? Being as specific as possible around this is really helpful. When people commit that I will make a smoothie on Monday morning, Wednesday morning, and Friday morning, they are much more likely to stick with it. It's amazing. It's almost like a date in the mind or on the calendar. And then we create something called contingency plans. Everyone in behavior change will hit obstacles. It's not if you don't do it, it's when you won't do it. And so it's really important to normalize that so that we don't just give up and just throw our hands up in the air the minute we hit a setback. So with the green smoothies, I would ask the person, what happens when your alarm doesn't go off in time and you don't have enough time to make that smoothie before you go to the office? Let's think about next steps so that you can still be successful at the end of the week with this goal. And then finally, supporting the plan. So these are all things that you can add to help support the person, and that's helping them identify supportive people in their life. Who is it that is their cheerleader, that they can go to that'll give them a high five when they've met their goal? Shaping your environment. Abby may have talked a fair amount about this. This is really important in setting you up for success. If you do set the goal of eating a whole foods-based diet, yes?
How important do you feel multivitamins in, or if you do them daily, do you feel they actually make a difference?
Well, the research says they don't, right? The most recent research says that they don't, and I have my own thoughts on that. I talk about it based on where the person is, what their diet is, what they are and are not getting from their diet, and I think it also depends on what type of multivitamin you're getting as well. So shaping your environment. That would be if you wanted to eat a whole foods diet, not bringing in the Cheetos. Just doing things so that you're not tempted, right? At the end of the day, that's when we have what's known as decision fatigue. We no longer have the willpower to say no to the ice cream carton that's calling us. So just don't bring it in, and that helps. If you want to start walking, put your shoes somewhere where you're just going to trip over them. Those kinds of things can be helpful. Tracking, research shows that just tracking when you're doing things improves your chance that you're going to do it. And finally, role models, right? Find the people that are doing what you want to be doing consistently and befriend them. Ask them how they've done it. See if they want to do it with you. Across the board, people are more likely to do things when they have buddies that are also doing it with them. Not in a codependent way. Don't depend on them, but it can be more fun. So, thank you guys. Any questions?
We'll start next week.
What's Thank you.
Sorry.
Yes.
When you say what kind of vitamins, what do you mean? As in brand or specific ABC or what?
It depends. There are different. It depends on what's in them. So certain forms of D, right? You want a lot of vitamins have something called D2 in them, and D3 is the most active form that's absorbed by the body. It's kind of involved. Unfortunately, it's not an easy answer, but yeah, it does depend. Yes. Yes. Which one? I haven't. Prevention. Oh, prevention. Yes. Thought you said Da Vinci. No, I hadn't. Yes.
Coaching is not really about Mr. Mostly manufactured, like you say, you're just gonna pay for it. People who have diabetes, they have some in their magazines. I do a lot of reading. I have a friend who has diabetes, and prevention magazine says you can reverse diabetes through the diet and the nutrition. Is that true? And exercise.
I am not a specialist in diabetes, but if you have type 2 diabetes, some people are able to manage their diabetes specifically through diet and exercise, and are able to bring themselves down to a place where they wouldn't necessarily qualify for the diagnosis. Yes.
The coaching he's been talking about is, problems walking in. Is there a national effort, a professional effort to burn this into positions like yours, into school systems, into curriculum? So, obviously,
Yes.
we want to make this a life habit, not
Right, exactly. There is a lot of, yes, is there an initiative right now to bring prevention and these types of things into curriculums, lower grades, those, and positions? Yes, I would say yes, across the board. There's a lot being done in elementary schools. There are a lot of pilot projects being done focused on nutrition and exercise and taking in preventive health in general. And then as far as medical schools, I'm excited that we got asked at Vanderbilt to be doing it with first-year medical students, and then we're being asked to go back and do some training with them later in their curriculum. We're doing it with the Vanderbilt Professional Interdisciplinary Learning, which is a group of pharmacy students, nursing students, MDs, and social workers, and we're training them all in health coaching. So it is getting there. These types of, this focus on behaviors and preventive medicine is making its way because it has to, right? Our burden of disease, as we saw, is huge. So now there's funding, and so we're getting these things in. Yeah. Yes.
What does it cost if someone wanted to come and use your department's services?
So a lot of our coaching right now is being done through our nutrition program, and I believe that I believe they do a package deal where it's I think it's like $90 for this first hour-long session, and then maybe $60 for follow-up sessions. That's typically what it was when I was doing a lot of the one-on-one coaching. We're working really hard to try and figure out how to get it so that we can bill for it. That's the big thing right now. We do, as nurse practitioners, we do coaching with our people that come through with us and do integrative health consults. That's part of what we do. It's not as structured as this because we're still obviously required to be doing exams and all of that. And this is part of why the insurance companies have really taken this on, is because they are paying to do it for free. Some of the insurance companies are training their coaches well. A lot of employers are now paying to have coaches. We've been hired quite a bit by outside employers in the Nashville area to be doing coaching for the employees.
You do groups rather than individual one-on-one, that would be cheaper.
Exactly, and that is something that we are moving towards. We have a lot of groups at our center. They are just working on starting a nutrition-based coaching group right now. So we're in the process. Right now, a lot of what we do is the employee-based coaching when we're talking about one-on-one coaching, and then we do a lot of education for clinicians. That's a primary focus for us right now. Any other questions? Yes.
If one has a diet that's pretty nicely balanced, eating all the things we're supposed to eat, but we add to that 6 ounces of wine every night and 2 ounces of chocolate every afternoon. There's a comment on that.
6 ounces of wine. Well,
Heavier person.
you know, it depends on the type of chocolate, right? Let's start there.
I like dark chocolate as well as milk chocolate.
Well, so the dark chocolate has health-promoting benefits. To be quite honest, I follow Abby's rule of 80-20. 80% of the time, have a perfect diet. 20% of the time, be moderate.
Thank you.
And I would say it depends on your liver. This is individualized, right? You look at certain societies. You look at in Greece, there is an area in Greece that's called a blue zone, right? And there are 7 blue zones in the world of the healthiest people. And in Greece, they in this one blue zone, they drink a moderate amount of wine every single night because the polyphenols in the wine are so high that they're they're healthy for them. So I think it depends on your own. I would say talk to your doctor. Okay. All right, well, thank you all very much.